New cases of COVID-19 in the U.S. are now topping 120,000 a day, a 20% increase over the past 2 weeks. Doctors are predicting a winter of severe illness and possible death for the unvaccinated, with the Delta variant still spreading and cases of Omicron now in nearly all 50 states.
If we're going to deal with Omicron successfully, vaccinated people need to get boosted, and obviously people who are not vaccinated clearly need to get vaccinated now more than ever.
But the push to get people vaccinated has fallen on deaf ears for a third of the country. Booster shots, too. Just under 30% of Americans have gotten them so far, with millions traveling for the Christmas holiday. Anxiety is surging, too.
I'm very concerned about it because the flights are full. Inside the lobby is full.
Protect us, don't inject us.
Vaccine hesitancy and opposition remain high, even with more high-profile deaths. Washington State Senator Doug Erickson was an outspoken critic of vaccine mandates. He's now died after a month-long battle with COVID-19. U.S. President Joe Biden will address a nation on edge Tuesday on how the country will fight this latest threat and federal help for communities overwhelmed with the sick and dying. Many hospitals are already stretched thin, including some in Ohio, where the governor has sent in the National Guard to help.
My biggest fear is just, the healthcare system at large being able to care for all the things that we've been asked to do.
Harvard University has joined a growing list of schools and companies going remote for the next several weeks. CNN has told most of its staff to work from home. Many New York City restaurants and Broadway shows have shut their doors as city officials dramatically expand the number of testing sites.
Omicron really has thrown a curveball here. I think that this is a temporary incident. I think Omicron is going to blow its way through the population probably very quickly. But we do face a hard 4 to 6 weeks ahead of us.
Complicating the situation, the two drugs most effective in treating COVID-19 for those who end up in the hospital are not nearly as effective fighting the Omicron strain.
It's a brand new version, and it is so different that it has the properties to potentially be evasive.
Pharmaceutical companies are working on new treatments, but say that will take several months. For now, healthcare experts say vaccines and boosters are our best weapons. Jennifer Johnson, Global News, Washington.